Hello, thank you for joining me on my channel, Mind Healing. My name is Miss Milka. I'm a psychiatric nurse practitioner. I am passionate about mental health. I believe that as a community, we should educate ourselves about mental health. We should educate our children, our teenagers about mental health. I also believe it's time for us to bring the end to stigma surrounding mental health. It's time for us to stop negatively judging people that have mental health. And that's the reason why I'm here today to discuss about depression. So what is depression? Depression is a mental health condition. It's very common. It's one of the most common treated mental health condition in our clinics. Depression can affect anybody. It doesn't choose the age. It doesn't choose your economic background. It doesn't choose your education level. It doesn't choose your race. It can affect anybody at any age. We have seen children as young as the age of 3 being diagnosed with depression. We have seen um, older adults over the age of 90 and above being diagnosed with depression. And so I would like to discuss the symptoms of depression. And I'm going to mention all the symptoms of depression. And these include depressed mood, sadness, there is lack of interest in things that one enjoys to do, decreased motivation, there is feeling of hopelessness and helplessness, there is problem with focus and concentration. We see changes in appetite. So one will have increased appetite. Some people will have decreased appetite, leading to weight gain or weight loss. There is changes in sleep pattern. Some people will sleep too much. Some people will have difficulty with sleeping. They might have problems falling asleep or even staying asleep. We have people having difficulty with focus and concentration. People have feelings of guilt and feeling worthless. Uh, People have decreased energy. They feel fatigue throughout the day. We have people with suicide ideation, constantly thinking about death, wishing that they were dead or alive than alive, thinking that they could take a break from life. So these are the symptoms of depression. And for you to be diagnosed with depression, you should have had these symptoms consecutively for 2 weeks. And you don't have to have all these symptoms that I have mentioned. You only need to have 5 of those symptoms to be diagnosed with depression. As a mental health nurse practitioner, I have seen firsthand how devastating this condition is to our communities. I have met parents who are grieving the loss of their children, the loss of their teenagers, the loss of their adult children through suicide. I have seen widows and widowers who have lost their loved ones through suicide. I have seen family members that have lost their families, their members of the family through suicide. I have seen friends who have lost their friend through suicide. And it's time, I believe it's time for us to come together, break the stigma surrounding mental health, embrace mental health as part of overall health, educate ourselves, educate our children as early as we can, educate our teens so that we can end the stigma surrounding mental health. So that if one of us, like I said, depression doesn't choose, it can affect anybody. So if one of us or if our children get sick with this condition, they don't have to hide it. They don't have to mask it. They come out and they seek help because there is hope. There is a treatable condition. There is medication. There is counseling. So it's time for us to end this mental health stigma surrounding mental health globally. There are some countries which have gone further accepting mental health. There are some countries which are still behind, but there is hope. It's time for us to embrace mental health. It's time for us to have conversations about mental health. I have seen families that are grieving the loss of their family members, parents, friends through suicide. And once that takes place, they are left with a lot of questions. They wonder, what could they have done? What did they miss? Why did their child, why did their teen, why did their loved one have to commit suicide without sharing what was going on with them? This is because of the stigma that surrounds mental health. If our other organs in our bodies, if our kidneys can get sick, if our liver can get sick, if our heart can get sick, if our lungs can get sick, if we can break a bone, if we have a UTI, if we have other medical conditions, we don't feel ashamed about it. We seek treatment and we show love to those people who have medical conditions. It's time that we do the same to the people that have mental health condition, that we show them love, that we show them it's okay to not be okay, so that when they get sick, they don't have to mask the condition, they don't have to go through the pain alone, that they can have hope that what they are suffering from is a treatable condition, so that they can seek help and they can get better. So this is the reason that I have made this video to discuss about depression and to discuss about stigma surrounding mental health. I'm so glad that you joined me today to discuss about depression. I would urge that you subscribe to my channel so that when I post a video, you are aware about it and you can be able to watch it. If you are a parent, you have a teen, you have a child that can understand the message that I'm trying to pass across, you have family members, you have friends that you think they can benefit from this message, I would urge you to share this video with them. I'm so glad that you joined me, and join me in this journey of breaking stigma surrounding mental health. Thank you so much. See you in my next video.